Greetings and welcome to another lecture in psychopathology. We're continuing with the neurodevelopmental disorders, and this time we're going to be hitting one of the big ones, attention deficit hyperactivity disorder. Now, this is probably something that all of us have heard of, although you may not be fully aware of what goes into it. There are actually two disorders. There's attention deficit disorder and attention deficit hyperactivity disorder. But for the most part, what we're seeing these days, at least in children, is ADHD. Attention deficit hyperactivity disorder. It consists of a persistent pattern of difficulty sustaining attention. That's the attention deficit, along with impulsiveness, again, attention deficit, and excessive or exaggerated motor activity. So it's not just that they can't pay attention. Like I said, that's what we tend to see in adult people who have ADD, is just problems with inattention. But there's also problems with movement. Too much movement, exaggerated movement can be a real problem. Students with this disorder often do much more poorly in school. A lot of school these days, of course, are things like you sit in class, you pay attention, you take notes. Even with children, there's a lot of sitting and paying attention. And kids with ADD and ADHD have a tremendous problem doing that. Particularly kids with ADHD, they have a problem doing both of those things. So they're going to do poorer in school because they're not paying attention perhaps as much as they should. They're also going to have a higher risk of problems because, if there's somebody in the classroom who isn't paying attention and who isn't sitting and such, it's going to distract everybody else as well as them. The numbers, of course, are always up for conjecture, but it looks like about 9% of children have this, mostly boys. This is not to say that girls cannot have it. It is simply that it tends to be found more in boys. And it may have something to do with the fact that boys have a tendency to be more active than girls do, to be more physical than girls do, and girls are much more verbal. And a lot of school this day is verbal. So it's difficult to say how much of this is actually disorder and how much of it is just differences between males and females. If we're expecting one sex to behave by the rules of the other, we're probably going to wind up with some deficiencies. Roughly half of kids with ADHD continue with that disorder. The H tends to get dropped, and so they wind up with ADD. But yes, generally people who have ADD as adults had ADHD as children. While about half appear to grow out of it, or at least to have the symptoms be small enough that it doesn't affect them as adults, generally, it's something that can definitely stick around. Causal factors. Well, as I was more or less talking about when I mentioned how the difference between boys and girls may be part of this, it does seem to be both genetic and social/environmental. Okay. It does appear to have a biological component to it, but as usual, it tends to be the environment that brings it out. And it just so happens that our particular school environment in many cases is really good at bringing out underlying issues with attention and with sitting still, basically. And they're also social environmental, like I said, because there's that environmental stuff that comes in there as well. We do know that boys and girls mature at different rates. Boys, well, actually, this isn't a boys and girls thing. This is more of a kids with ADHD versus kids without ADHD. We do know that boys and girls mature at different rates. But when we're talking about ADHD, we're talking more along the lines of kids that have been diagnosed with ADHD tend to have brains that are slightly smaller than average. Now, we know that there isn't necessarily a link between size of brain and intelligence, but yeah, if your brain is on the smaller side, it's quite likely you're not going to have the connections, you're not going to have the bulk of neurons that might allow some of these things to be learned better. Because if you're a kid, paying attention and sitting still can be very, very hard. We know that the brains of children with ADHD mature more slowly than the brains of children who do not have this. This can also contribute. We may expect by the time kids are 9 or 10 or 11 that they should be able to sit for, 45 minutes, 50 minutes, maybe even longer, when in fact, kids whose brains mature later may not have that ability. They may still have those younger brains that like to keep moving. The general treatment has been medicinal, has been pharmacological. And it does appear, interestingly enough, that stimulants calm down people with ADHD. And that has confused a lot of people. If stimulants rev you up, if stimulants get you going, how exactly do stimulants then calm kids down? Well, it appears that the parts of the brain that get stimulated in kids with ADD, ADHD when they take stimulants are the parts of the brain that, when stimulated, calm down the brain. There are different parts of the brain. Some are gases and some are brakes, if we want to use an automotive analogy. Hitting the gas with a stimulant is going to cause more behavior. Hitting the brake with a stimulant is going to cause less. And for the most part, stimulants for kids with ADHD are brakes, not gas. And this is also true in adults with ADD who take these stimulants. It also helps to put the brakes on that out-of-control activity or inability to focus that adults have and allow them, therefore, to be able to do better in school, do better work, focus on things. The problem, of course, is that we don't know what long-term use of stimulants is going to do, particularly when we're giving them to children. Okay? Long-term use of stimulants in children, those brains are developing. We don't know what long-term use of stimulants is going to do with children whose brains are still developing. Okay, it may cause interesting side effects. We don't know. There are psychological treatments which involve, reinforcing and shaping and various types of family therapy and such like. But for the most part, a lot of times people tend to go for the medicinal ones. There are a number of other things that people have claimed to help, from cutting out sugar to cutting out dyes. There doesn't seem to be good, double-blind studies on that. There's a lot of anecdotes. The problem is that when they get tested in a double-blind situation, these generally don't work any better and often work worse than stimulants. So if you're thinking about using something else to treat ADD, ADHD, particularly if it's in your child, but also if it's in yourself, it's a really good idea to go see a doctor or at least read up on what it is that you're planning on using. The second disorder we're going to be talking about here is another very big one, autism spectrum disorder. Now, autism spectrum disorder is indeed a spectrum. It's a long list of behaviors. It used to be broken down more into things like Asperger's and such. They all got lumped together in the latest DSM, which is part of the reason why people were saying autism's cases exploded in 2013. That's because we started categorizing them differently, or at least that's probably part of the huge explosion. It wasn't. We just dumped everybody in different categories in the same category, and that category, not surprisingly, exploded. It does seem to affect about 1 in 68 children. Realize that autism, like everything else, is on a spectrum. I mean, it's in the name. So it's possible to have just a little tiny bit of autism, and it's possible to be completely wiped out by it. So when we're looking at this number, don't assume that 1 in 68 children are completely wiped out by autism. They are not. This is usually identified before 30 months of age, because a lot of autism is problems with social communication. Problems with communicating with others. And in fact, very often, these problems, which can range from things like not making eye contact. Babies make eye contact, but babies who go on to develop autism do so less. And this starts to emerge pretty quickly, by about 6 months of age, and often becomes even more obvious between 12 and 24 months. There's a very wide variety of symptoms and levels of impairment that I pointed out, but they tend to be utilizing these. They tend to be social deficits, in that kids with autism often have problems dealing with other people. Okay, they don't understand how, social things work. They don't understand give and take. They don't understand any of a number of things that go with social behavior. It isn't that they don't have emotions. Sometimes it's thought that kids with autism don't have emotions, don't have feelings. They do. They simply don't show them necessarily. They don't know when is right or when is wrong. They may have determined it's better not to. There's an absence of speech. They may start out, talking and such, but then oftentimes they stop. They may not speak at all. They may just say, like, yes, everything is yes. They may show echolalia. Now, what echolalia is it's repeating what has been said to you. So if you're repeating what someone else said, that's echolalia. Sometimes it could sound like speech. You say to a child, oh, look, there's a doggy. And the kid says, look, doggy. Oh, look, there's a kitty. Look, kitty. That kid may just be making these sounds that you just made. And if so, that's not language. That's echolalia. There is self-stimulation. A lot of kids with autism wind up doing behaviors that sort of draw them into their own little world. Probably the best known is rocking. Kids with autism will very often just sit and rock and shut everything else out. Or they might spin, or they might flap their hands, or they might hit their heads into the wall, or they might do any of a number of things, and they'll do it for hours on end. And that's called self-stimulation, or sometimes just stimming. And there's some discussion as to what might be going on here. I mean, we don't really know what's going on here, but people with autism who sometimes recover and sometimes they're just high enough functioning often say that what's happening here is they can't shut things out. That they have to notice everything in their environment, that things that other people can shut out, from the feel of the clothing to the sound of the heater in the background to, the smell or whatever, they can't shut it out. Everything is infringing on them. And the only way to deal with that overstimulation is to do this self-stimulation and shut down. Shut down everything. And that also might be why there's not a lot of social contact, because having social contact with people can be very stimulating. I mean, there's all sorts of information coming in, and sometimes it's easier just to shut down. And it might be easier just not to talk, to just try to reduce that. We don't know. It's anecdotal, but it fits what we have. And it might go along with things like maintaining sameness. Most kids like things to stay the same. They like rituals. They like predictability. Kids with autism even more so. They just do not want things to change. And anything changes. Anything changes. As simple as, not wearing the right clothes, or not using the right silverware, or not eating at the right time, can just be completely overwhelming to these kids and adults. Causal factors, we do not know. Except for the fact that it appears more recent research seems to indicate that it is pretty much purely biological. They used to think that it was because you had a cold mother and, the refrigerator mother. No, that's not going to help things, but it's not going to cause it. It really does seem to be inherited, which is why we will see parents with multiple children with autism. And it also appears to be hugely polygenic in that it's caused by multiple genes. Okay. The other thing we know it's not caused by the way, is vaccines, because of a very long, very detailed study done in parts of Scandinavia where health records are kept on everyone. And they compared the data, a rate of autism for children who had received vaccinations to children who hadn't, and they found no difference. The thing is that about the time that these symptoms tend to really show up, which is about between 12 and 24 months, is when kids get a lot of vaccinations. And parents tend to put one and one together. But in this case, it's not two. It's actually something else. They have nothing to do with it. It's actually not one. 1 and 1 doesn't equal 2 here. It equals 1 and 1. And in some cases, it's possible to see differences in brain development before these symptoms start to show up. It may be inherited. It may come from individual mutations. We do know, for instance, that in this case, the older a father is, the more likely their child is to have autism. That's a possibility. But it does appear to be biological and not caused by vaccines. There's a lot of trendy stuff out there to treat autism, and most of it is completely worthless. Okay? At least on a larger scale. The best treatments seem to be really long-term, intensive conditioning, learning, training. And we're talking from the time the child is diagnosed for years. Does this work? It can. It doesn't always. But generally, there's at least some improvement. But it is incredibly long-term. It is incredibly time-intensive for both the teacher and the child and the parent. But at this point, it's pretty much the best that we have.